Welcome to Working with Clients Who Have Diabetes or Prediabetes, What You Really Need to Know. I'm your presenter, Dr. Sheri Colberg, Professor Emerita of Exercise Science from Old Dominion University. I also have quite a bit of experience with diabetes myself. So let me tell you a little bit about myself, and then we'll talk about how you know if your clients have diabetes or prediabetes. I have actually been living with type 1 diabetes since 1968 when I was very young, and I've learned how to manage it quite well and to be active and do all the things that I'd like to do with it. I've also made that my career, working with people with diabetes, doing research in diabetes and exercise, and really just improving how well people can manage diabetes around physical activity. So it's really an important topic because, as you can see from this slide, that the estimate a couple of years ago was that 463 million adults around the world have diabetes already, and they expect this number to keep rising exponentially. And honestly, in the United States alone, it's estimated that more than 1 in every 3 people has either diabetes or prediabetes. So we'll talk a little bit more about these conditions and what that means. So first off, you might have heard of blood sugar. I like to call it blood glucose because there are just too many sugars out there, and it really is confusing to talk about the sugar that's found in your blood, which is glucose. It is a very simple carbohydrate, and it is what our bodies really need to have there. Most of it comes from the food that you eat, but it also can be made by your liver in order to maintain it at a certain level at all times. And why that's really critical is that your brain and your nervous system both use glucose as their primary fuel. So when you don't have enough glucose in your blood, your brain doesn't work properly, your nervous system may not work properly, and that affects physical function and ability to exercise. We also know it's really important because we have 5 different hormones that actually can raise blood glucose levels. And that is interesting because when it comes down to how do we lower it, we actually only have one, and that's insulin. This is a hormone that's made by part of the pancreas, which is an organ in your belly. So what the blood glucose needs to do is stay at a balanced level, and we have those 5 hormones that can raise it and only 1 hormone that can lower it. And hopefully those 2 are kind of balancing that out on a regular basis so that you maintain a blood glucose in a normal range all the time. So what happens is we can get diabetes where this is no longer the case, or even pre-diabetes where we're at high risk for developing diabetes. You can see here some celebs who've been known to have diabetes. I'm going to talk about the 3 types listed here in bold first today, 1, 2, and prediabetes. And gestational occurs during pregnancy in women, but I'm not going to talk about that today. So what is type 1 diabetes? We know that around the world that this accounts for at least 5%, maybe up to 10% of all the cases globally. This is in 2021, when I'm recording this, is the 100 years since the discovery of insulin, which is quite amazing because before there was insulin, everybody just died from type 1 diabetes. So what happens is that the beta cells in the pancreas that make insulin are destroyed by the body itself through what's called an autoimmune destruction. And the onset is more common in people who are younger, so it used to be called juvenile onset, but it actually can occur at any age. And I've known people of all ages who've developed type 1 diabetes, so it's not just in younger people. And in fact, even if people get it when they're younger, because once you get to be an adult, you're still living with it, most of the people who have type 1 diabetes that you run across are adults. So they have to replace insulin either through regular injections with syringes or with insulin pens with an insulin pump, or there is one type of inhaled insulin that's possible. With type 2 diabetes, this is the majority of the cases around the world. It is really characteristic of people who are overweight. However, there are many people who are not as overweight as the people in this picture here who also have developed type 2 diabetes for a variety of reasons. But one thing they most all have in common is that they're very resistant to the insulin that their body does make. And so even though they may have really high levels of insulin, they're just not using it well. And over time, they lose some ability to produce insulin for a number of reasons. And when that happens, they kind of tip over into that point where their blood glucose starts to rise. So this is actually more common in adults, but has become more increasingly common in younger individuals as well. And these people may or may not need to take insulin because there are a variety of other medications that are available to treat it, as well as lifestyle management. Prediabetes, in the United States, at least, 1 in 4 adults is considered to have prediabetes, which means that they're in a really high risk category for developing type 2 diabetes. Their blood glucose levels are elevated above normal, either fasting, like first thing in the morning, or in response to meals, or possibly both, but not in that range yet where they can be diagnosed. Now, this is considered to be a reversible condition. So with proper lifestyle management, including physical activity, it's possible that these people may not need to ever be treated for diabetes. So does it matter if your clients have diabetes? Sure, I think it does. It can impact them in so many different ways. So this is just sort of a short list, but they may not be quite as healthy. There are various reasons that may come up that keep them from being as active as they could be. Either it's not safe for them or it's not quite as effective. So again, that affects their athletic performance. Sometimes they have big impact on their emotional state. People with diabetes tend to have more depression and anxiety and so forth. Certainly increases the incidence of injuries. And that is something I'm going to talk a little bit more about. In terms of motivation, even just to get up off the couch and be active, it might impact them, as well as many other aspects of having these conditions. That said, there are many successful athletes who have diabetes. All the ones in the picture here are athletes with type 1 diabetes. This is an older picture. I could probably quadruple the number of athletes I could come up with now that have been really successful with diabetes. So really what it comes down to is how do you go about optimizing how well you perform and how well you can be athletic if you have diabetes. Now this man in the picture here is a man who at the age of 95 with type 1 diabetes was doing the Senior Olympics and set some records in long jump and some other performance events and lived to be almost 103. So I'll summarize in a few words the keys I think are most important for being successful with exercise when you have diabetes, especially if you have to take insulin. You got to balance out your blood glucose. So you don't want to go too high, you don't want to go too low. And you also need to do what normal athletes do, or anybody who's active is fueling properly with carbohydrates, BG or blood glucose, muscle and liver glycogen are important to manage. That's the stores we have in the body, as well as our intake of fats and proteins. I'll touch on some of those. Basically, why it's important to sort of stay normal. Euglycemia in the top panel here means normal blood glucose. So insulin levels normally go down when we exercise, and counter-regulatory hormones or glucose-raising hormones go up. So basically what you see on the left is the liver, and what you see on the right is sort of muscle depicted. So what you'd want to do is have the liver producing enough glucose to make, and balancing that out with what the muscles are using. But what often happens is the middle or the bottom scenario, where you may either have too much insulin and maybe your liver can't produce enough to balance that out, or you are hyperglycemic, where basically your liver's producing more than what you need and more than what your muscles are taking up. So we do know generally that when people start doing some kind of a moderate activity, so like let's say brisk walking or prolonged activity, that blood glucose is going to go down over time. And that's because blood glucose can be used as one of the primary fuels of your muscles when you're active. So blood glucose is used as well as other carbohydrates, so carbohydrates stored in muscle, and as well as some fat, and depending on the duration, minimally a little bit of protein. But if we have any extra insulin in your system, it actually promotes the uptake of blood glucose and its use. And so that it can be a problem when people have too much insulin on board, that they might actually use extra. And that can impact their sports performance. Sometimes exercise, however, can have the opposite effect, where it'll make blood glucose go up. And here are some situations where that may be the case. When your exercise intensity is really high, so it's sprinting, or it's just a really intense thing you're doing, if they start out with blood glucose that's already elevated, it can actually go higher. If there's a lack of insulin in the body, usually, say if you take insulin and you didn't take the insulin you're supposed to, and you're really insulin deficient for any reason, then there's nothing to balance out those glucose raising hormones from going crazy and releasing a lot of glucose. Or if you've recently taken in some foods, sometimes that's not digested as quickly while you're exercising, and it may actually cause it to go up during exercise or afterwards. So most people have to monitor their blood glucose, particularly those with type 1 diabetes. And this shows you some various options for doing that now. Blood glucose meters just give you a single reading at one point in time. What's helpful about some of the continuous glucose monitoring devices that we have now is that they'll give people alarms for going too low or too high, as well as showing them trends and patterns over time. It gives them a little bit more chance to jump in and try to manage things on a real-time basis, and instead of just trying to catch something 4 or 5 hours later. And then the A1C is the average blood glucose over the last 2 to 3 months. And that doesn't really tell people a whole lot about whether they're having big spikes after meals or a lot of lows with exercise, but it is the measure that a lot of doctors still use to follow their patients. Although there is another one now that's called time in range. If you have a continuous glucose monitor, you can see how much time you spend in a really optimal range during the day. In terms of training, there is also an optimal blood glucose range. And again, this is more anecdotal than experimental, but most people find that if their blood glucose is somewhere between 80 to 180 milligrams per deciliter, which in millimolar is 4.4 to 10, that they find that they perform better. If they start out a little higher, sometimes people do that in preparation, knowing that it's going to drop during activities. But if you start out lower, the only case where people may do that is if it's going to be really short and you know it's something that causes your glucose to go up anyway. So a really important concept is that you have 2 different ways to get glucose into your muscles and other tissues. And at rest, the only thing that works is insulin. So if you're insulin resistant, that could be a problem, but also if you don't have enough insulin in your system, that's a problem. But during exercise, insulin has an impact, but so do contractions. The actual muscle contracting by itself allows you to take up glucose. And the good thing about that is that it gives people a natural way to lower blood glucose if it's elevated just by doing muscle contractions. The bad thing is that we know that these are not only separate but additive mechanisms. And so if people have too much insulin on board and do exercise, they can actually drop really quickly, and that can be problematic. And when that happens, people will get all sorts of different symptoms. This is really a short list, but I can tell you from experience that it really varies by person. It varies by the activity. It might even vary by the time of day, when you last ate, if you exercised recently and you're already sort of glycogen depleted. and so forth. It's also confusing because when you release adrenaline for any other reason, you get similar symptoms many times. So if you're almost in a car accident or something, that feeling you get with the shakiness and the heart pounding, those are all symptoms of hypoglycemia. You don't even know if you have diabetes, if you're getting low, or if you've got adrenaline release for some other reason. And you must treat this most of the time as quickly as possible. We do know that glucose, because you're replacing the blood glucose, glucose is the fastest way to do it. If you can take in glucose tablets or something that contains glucose. Glucose is also known as dextrose when you're looking on food labels, and it is the primary thing in most of those sports drinks. They have glucose polymers in them, but you can also get Smarties because those are made out of glucose. Most things are made out of sugar. The simple table sugar, only half of that is glucose, and the other half is a simple sugar called fructose that's found in fruit that's absorbed more slowly. So straight glucose does work better. We also now have something called glucagon. This is the main glucose-raising hormone released by the pancreas as well, that helps raise glucose quickly. And there have been these injections available, and now they have some pens as well as a nasal glucagon. They don't have any little mini rescue ones, but they do have ones for people who can't self-treat a low blood glucose. So there are many things that people can do to try to prevent lows. They can assess how much their risk really is there for getting low during exercise, knowing that if it's a new or something that they're not used to doing, that they're more likely to use more glucose and end up with a low. Or anytime that they're exercising when their insulin is circulating at higher levels, like after a meal when the insulin hasn't really decreased after that time yet. And so they can take steps like reducing insulin doses, especially mealtime doses. Sometimes people have an insulin pump can reduce their basal or their background insulin, as well as reducing insulin doses overnight after they've been active and so forth. They can increase their carbohydrate or their food intake, and they can help look out for the later onset lows that might come on after you've had a particularly strenuous workout, and then use higher intensity exercise, in some cases sprinting and other things, to help raise it, because we know that that can do that. And also, when I mentioned the delayed or later onset lows, it's important to realize that those can occur up to 24 to 48 hours, but most commonly is not only just during exercise, but 6 to 12 hours afterwards. And so, unfortunately for a lot of people, that's in the middle of the night. That's not a great time to get a low. They don't always wake up as fast or recognize it as quickly. And this is because during that period of time when your muscle is trying to restore the carbohydrates that you used from muscle, the glycogen, you're much more insulin sensitive. And again, you have to make regimen changes like taking in less insulin or eating a little bit more food or a bedtime snack or sometimes to prevent these. One other thing to be aware of, it can be problematic, is that particularly in people with long-standing type 1 diabetes, but also in some with type 2, they don't have the normal release of glucose-raising hormones in certain conditions. So we know from studies that when people have had a prior bad low blood glucose, that it blunts their response to the next time they exercise. So they may not release those glucose-raising hormones quite as well to try to maintain their blood glucose. We also know that if someone's had prior exercise, the next time they get low, they may not respond as well. And so they get sort of a blunted or mediocre response to the next low, either the same day or the next day. And so this can be really problematic. It kind of sets people up for getting lows when they're regularly active. One other thing to keep in mind is that exercising when blood glucose is too high is also not recommended. In fact, the recommendations are that people avoid exercising if they're hyperglycemic with their glucose over 250 or 13.9, depending on your units, and they have a significant amount of blood or urinary ketones. So ketones can be produced when you're on a low carb diet, like a keto diet, because I'm sure you've heard of that. But when you get the ketones associated with hyperglycemia, with high blood glucose, those are way higher than what you get from a keto diet, and actually can cause acidosis and cause a life-threatening condition. So it's recommended that unless you know exactly why, like you just ate and you mismatched your insulin with your food and you can go exercise because you still got a lot of insulin on board, unless you know that, you're not going to want to mess with this. So you can see here some of the symptoms that are shown there, but usually it's when it's more chronic that it's a big issue. And then for people who have insulin, this is more related to type 2, just use caution if exercising with their blood glucose over 300 and no ketones. But this can also happen if you're an insulin user and it's just a short little pop up over that 300 range. And you can also do things like if you have your exercise causes your glucose to go up, you can do either treat it with more insulin afterwards if you take insulin, or you can do an easier aerobic cool down to help lower it, because we know that helps lower blood glucose with the muscle contractions. And as you can see here, I'm not even going to try to discuss all of these, but there's so many different factors that can impact how blood glucose responds. If you just think about the environmental ones, we actually even know that the risk of developing type 2 diabetes is worse when we have like environmental smog. So that's not even on my list, but it can impact various things. I mentioned the prior hypoglycemia, prior exercise. The actual name of that is hypoglycemia associated autonomic failure. But then their nutritional status, hydration status can affect it, starting glucose levels, as well as all the different things related to exercise, like type and duration and timing and so forth. One of the things I do want to mention is we know this is pretty consistent, that the type of training does have a discernible effect on blood glucose. So if you're doing something short, like sprinting or powerlifting and so forth, because it doesn't last very long and it's very intense, it causes a big release of those glucose-raising hormones, and glucose usually goes up in response to that. If you're doing a mixed kind of stop and start activity, basketball, soccer, hockey, so forth, you might actually maintain your blood glucose better without it going too high or too low, unless you're really nervous. Because I've had plenty of kids tell me when they play basketball, they get really nervous, and that will also release adrenaline and cause their blood glucose to go up. And then if you're doing more aerobic type activities or extended things for a period of time, it's more likely to decrease over time. And this has a lot to do with the energy systems that we're using as well. So what this chart shows is that we have a short energy system that's called ATP creatine phosphate. It's immediate energy. It's basically just the energy currency we have for muscle contractions. And this is what's stored in muscle that's available immediately. And it only lasts for 5 to 10 seconds, honestly. And then when you use that to do a power lift, for example. And then if you're doing an intermediate sprint, you'll use the glycolytic system. Not everybody's familiar with, because that's where you have the lactic acid created and build up an acid in your muscles, and that burning sensation you get even when you just start a regular exercise session. And that peaks at around 30 seconds to 2 minutes, and then your aerobic system takes over if you do something for longer. So most of the events that most people do use aerobic energy, and that gives you a lot of fuel choices, but it takes a couple minutes to gear up everything to provide energy fast enough to be able to do that through the aerobic means. But if you're using just one of those first two energy systems for your activities, you're more likely to have your glucose go up than down. And as I've mentioned, it is really important to be able to manage blood glucose in order to perform well. We know that carbohydrates are a primary fuel for most things that we do that are moderate to intense. Maybe when we do things that are really light activities, then we can get by using a little bit more fat. We also know that people hit the wall or bonk and have to stop or slow down if they run out of glycogen in the muscles that they're using. And that's no good. And if they get hypoglycemic, if their blood glucose is dropping, then they may actually have to stop exercising. And again, all these things can be really bad for training and performance. Generally, the exercise and carb use is, you can see here as you go from 25 to 85 on across this chart. 25 is really light activity and you're using more fat than anything. But as you start to increase up to moderate activity, where you see the 65, you're actually going to use a lot of muscle glycogen, which is the carbohydrate that's already stored in muscle, as well as the glucose that's being released by the liver, and use a little bit of fat because you've always got some tissues that are not directly active that are using it. But during harder exercise, carbohydrates are really the only fuel that you use. And most of it comes from the stored glycogen, about 80%, and 20% is from blood glucose. We don't have a lot of glucose in blood. We only have about 5 grams total, depending on body size. But that's not a lot of carbohydrate. That's only about 20 calories worth of energy. And so it's important that your body can produce more, or that you maybe even supplement with carbohydrate while you're doing an extended activity to give your body an alternate fuel. And then during rest and recovery, that's when we use most of the fat. And that's when it's really important for recovery, because we're trying to replace the carbohydrates that we used. So a lot of things come into affecting how people respond to various things. I mentioned kids playing basketball. When they're competing, they actually will have a different blood glucose response than if they're doing a practice, when it tends to be lower. How much muscle glycogen is being used at any time, the time of exercise, and there's a lot to do with that, where it really can change, because you may be more insulin resistant in the morning and less insulin resistant in the afternoon. How fit you are, so how accustomed you are to different things, the environmental factors like heat and humidity, and then even with women having to deal with hormonal cycles and or pregnancy. And then just going to talk a little bit more about exercise in general. So if you had to say which exercise is best for diabetes, I always ask people, pick one of these, and they're like, well, I would actually say all of them are really important, but if I had to just pick one, I would go with resistance training. So let's talk about why. So with muscle mass, what we're looking at here is kind of like a cross section through someone's thighs using a CAT scan. And I know it kind of looks like a ham with the bone in the middle, that's your leg bone. And then around that's muscle, and then the outside is the fat that's under the skin. And if you're looking at the left side of this versus the right side, the left side, the ham looks pretty healthy, the muscle's pretty healthy. But you look on the right side, this is what happens when people are inactive or they have a disease state. And the muscle can really get marbled with fat. They can get a lot more extra fat. But it makes it so you have less of a storage capacity for the carbohydrates that you eat, because carbohydrates are stored primarily in muscle. And so what we want to do is we want to maintain and gain muscle mass. And the best way we can do that is with resistance training, because with aging, we're going to be losing some muscle. And with inactivity, we certainly lose it. And with people with diabetes, the loss of muscle mass is even faster. So I mentioned a lot of these already, but if it acts as a carbohydrate storage tank, it's really important to keep that tank not only as big as possible with training, but also to keep that tank always partway empty, so that we have the capacity to add more whenever we eat. And so what's recommended is that people do resistance training at least 2 to 3 non-consecutive days per week. And also, when people are trying to lose weight, it's really important to counsel them to do some resistance training, because what we know is that people are typically go on a weight loss diet. They may be losing muscle mass, like 3 pounds out of every 10 pounds that they lose, and not just fat mass. But really, you want to keep the muscle and lose the fat. And the best way you can do that is to try to do resistance training while you're on a dietary restriction of any kind. So you don't want to lose any more than 1 to 1.5 pounds for every 10 pounds. We know that doing any kind of physical activity is going to help prevent the loss of some of this muscle mass, but resistance training is particularly helpful when we do that. For older adults in particular, doing balance training is really important because we have a much higher risk of falling. Our balance is not as good as when we get older. And then a lot of people with diabetes also have loss of sensation in their feet, known as peripheral neuropathy. And doing lower body strength training helps a lot. So they can do a number of simple practice exercises to try to keep their balance better. And the ones that are depicted here are just grabbing a towel with their toes, but also practicing standing on one leg, or doing that holding on with two hands, one hand, one finger, no hands, practicing with their eyes open or closed. And this can be done many times during the day. It's also important to have people focus on doing some kind of cardio aerobic training, both for fitness gains, but also for weight management. Flexibility training is also important because a lot of the lack of mobility around joints is going to predispose people to falling, helps prevent injuries. And doing combined training, is a lot of studies have shown that that's optimal. But really, when it comes down to it, if people want to maintain and continue to be active, they have to pick things that they enjoy doing. So we know that many things can cause people to stop exercising, but these are the primary ones. So most people say they have a perceived lack of time. Sometimes that has to be addressed by figuring out how they can fit in shorter bouts of activity throughout the day. Another thing is having them start at too high of an activity, and that too high of an intensity, which makes the activity hard to do or unfun, or causes them to get some kind of exercise-related injury, which is also going to cause them to stop. All these can be demotivating and not good if you're trying to promote lifetime exercise. And a really important point is that injuries are more common in people with diabetes, and this is for several reasons. One is that we know that when blood glucose goes up, even if it's after meals temporarily or anytime, that more of it gets attached to collagen and the joint surfaces and makes those more brittle and less flexible. And that ends up resulting in a lot more overuse injuries, all the inflammatory joint problems, itises, tendinitises, and so forth. And then a lot of people with diabetes, particularly with type 2, but also many with type 1, have excess body weight and then have arthritic joints and issues related to that. And then finally, there's some other medications, both diabetes and others for lowering cholesterol, like statins, that can cause problems with joints and tendons and may result in a higher incidence of injuries in this population. But certainly you can do things to help people prevent injuries. Doing an appropriate warm up and cool down can help, including some stretching and flexibility. Starting out and prescribing an appropriate exercise intensity, and then having people do a slow progression with adequate rest in between workouts. Say the 2 to 3 days of resistance training a week should have a day of rest in between for that type of activity. And then doing a variety of activities, and particular cross training, seems to be really effective in terms of helping to prevent injuries, not having people do the same types of stress on their body every day. So we know there are a number of barriers to being active, and this cartoon is good. Well, I see you've doubled your amount of daily exercise. Unfortunately, 2 times nothing is still nothing. So in the population with diabetes, in particular, fear of getting hypoglycemia for insulin users is a particularly well-known barrier to activity. They have to learn how to balance all those factors out. But also people who start out sedentary may have a harder time with becoming active. People have various complications related to diabetes, including loss of sensation in their feet, and just not having a supportive group to exercise with, or a place to do it, and all these are potential barriers. And finally, when talking about having your clients progress, it really depends on the rapidity with which they should go forward, depends on how old they are, how fit they were when they started working out, what their actual goals are, whether they're fitness related, health related, or athletic related, how well they can manage their diabetes when they're doing all these things, and any other physical limitations or health concerns that they have. And I would just say this over and over again: err on the side of caution, start slowly and progress slowly. Think of it more of a lifetime thing. You're just trying to get them started to keep them going. You don't want to deter them from doing either of those things. So generally, burpees are not a good place to start with. Most older individuals or sedentary clients with diabetes, just simply because they can be demotivating. They can also cause injury, unless somebody is really young and already active. If they're going to do CrossFit or high intensity interval training, they need to, according to the American College of Sports Medicine, the American Diabetes Association, get medical clearance prior to participation, particularly if they've been sedentary or have any cardiovascular disease risk factors that predispose them for a heart attack or stroke. And most with diabetes already have some of those risk factors. Really work with them to establish a base of fitness first before that they go on to do most of these activities on a regular basis, and introduce them slowly, give them a time to adjust to them without getting injured. And also keep in mind that not every day is going to be the same for somebody with diabetes. They may have good physical days, they may have bad ones, they may have good emotional, mental days, and they may have bad ones. And knowing that this is a possibility, always have contingencies, backup workouts planned out where things that they can do or alternate activities, and make adjustments during a session, just to prevent demotivation and prevent injuries. Again, err on the side of caution with these individuals. And can people exercise with complications that are related to diabetes? Yes, I have found very few where there isn't something someone can do. And as you can see from this list here, the more common complications: heart disease, hypertension, very common, just having cardiovascular risk. Actually, the most common one is loss of sensation in the feet, and this can be problematic because it sets people up for falling and also changes their gait. And then a lot of them also have arthritic and joint limitations. And I've met many people now, older people who've had hip or knee replacements. And they can exercise, but it needs to be done carefully so they're not aggravating any of those joints. So in summary, the keys to exercise success are balancing blood glucose and fuels as best you can to optimize performance, as well as just athletic participation, avoiding blood glucose lows and highs during and after exercise, balancing carb intake with insulin doses. And that can be done in a number of ways, both during and after exercise and even before. And then finally, taking steps to avoid and treat injuries to keep people active. And as you can see the pictures here, these are all very active and competitive people with type 1 diabetes. So I've listed a few references here if you need to find some more information and where a lot of this came from, as well as my website called diabetesmotion.com. You can go on there and get free information about almost any type of activity, as well as some training tips and a blog that is very current on the latest topics and issues related to diabetes and exercise. You can also become a diabetes specialist by taking a series of courses. I have them all listed on my website, Diabetes Motion Academy, dmacademy.com. But most of them are offered directly through organizations for fitness and other professional organizations like American Council on Exercise, American College of Sports Medicine, and many others. Also have written a number of books, but one of the ones that would be most appropriate for people just starting out or people at all levels with all types of diabetes is called Diabetes and Keeping Fit for Dummies. That can be very useful. Specifically for people who are insulin users, I recommend The Athlete's Guide to Diabetes. I redid this just a couple of years ago from a decade before, and it's now up to over 165 different sports and activities, giving real life examples of what people do to manage their diabetes regimen when they're doing a particular activity, but also gives a lot of background on exercise in general. And if you have any questions, I am happy to always answer them. So please feel free to contact me at my email address here, as you can see, and appreciate your getting more information. I hope to hear from you soon.